Oh yeah.
All right.
All right, buddy, we're live. Thanks for joining me. Sorry for the technical difficulties. You know, they don't teach me how to do Facebook live streaming at the I Love School of Theology.
Gotcha. It's a pleasure. Thank you for having me.
Paul, can you just tell folks who are watching like what you do on a day in and day out basis and where you're at, and kind of get people acquainted with your work?
Sure. I for the past 8 years, I've been the pediatric intensive care unit chaplain at Children's Hospital, Colorado. Day in and day out looks different. Sometimes there are long-term cases, illnesses. Other times there's traumas that come in. We're the only trauma one hospital in a 7-state region, so we kind of pull from all over the country for different specialties and to serve children in our area. Yeah.
Where do you spend most of your time, with children or with like staff and doctors, nurses, faculty, all that?
I try to split it evenly. I think each day is different, which is one of the things I love about my position, is that I never have a routine. I kind of have to be on my feet at all times, and it's a really rich place for ministry and serving people. And so, you know, some days it might be 80-20, other days 50-50. I try to meet the needs of the patients and families first, and keep in mind that the people who are also caring for them at the same time. So,
how is the environment right now with the COVID-19 virus, and what's everyone feeling?
You know, I think to be expected, emotions and anxiety is high, and it's scary. I think there's a lot of fear of the unknown. You know, I think that's one of the main things that I minister to is fear of the unknown. And with COVID-19 and coronavirus, you know, I think there's an added level of not knowing what's coming or what the future is going to look like. And as of right now, you know, children aren't really being affected, but you know, that doesn't mean that the adults are also being impacted or you know, in harm's way. And so it just adds another level of anxiety for everyone.
Yeah, I can imagine. Are y'all having to take really special precautions? Are y'all limiting visitors right now and all that stuff?
Yes, you know, our hospital has stepped up in a big way of trying to create a safe environment for patients and families and for their team members and staff and employees. And so there are certain precautions that we take if someone is under testing to see if they're positive for COVID-19, a rule out, you know, with special precautions as far as, you know, protective gear and things like that. And then there's talk of going down to a skeleton system, which would lessen the exposure for team members who are non-essential staff or anybody who's not a nurse, an RT, or a doctor.
Right. So, and that's to keep the health professionals healthy as much as anything, right? So y'all can continue to function and operate at full capacity as possible.
Yes, yeah. Just to try to limit the exposure and be safe and to protect the team members of Children's Hospital Colorado. So
yeah, so I mean, y'all have to deal with kids who are really sick a lot of the time, right? So this isn't like super uncommon for y'all to already be taking special precautions around certain patients, I imagine. But now you're just kind of blanketing the whole hospital with these precautions?
Yes, so there are checkpoints at every door, and employees are only allowed to use the employee entrance, and it's a much more heightened safety precaution, I think, you know, which on the one hand creates a lot of safety and support for people, but then also can increase fear and anxiety and a different type of reaction. And so it's it's a lot of shifting that reaction that some people have, you know, whether it's with parents and reassuring them that, yes, this is scary, but this is to keep your child safe and to keep you safe. And, you know, with employees, it's saying, yes, you know, we understand that it's a hassle, but it's to keep you safe. And certainly it's respiratory season anyway. So it's the busiest time of the year for children's hospitals. You know, we have flus, we have respiratory things that come through. And this is another, albeit, you know, we probably don't know as much about this particular virus as we do some of the other ones. It's still, we still are practicing hand washing and precautions anyways. You know, nobody under the age of 13 is allowed to visit in the hospital who's a sibling. That's just to keep people safe and patients safe as well. So that's already in place, and now we're even limiting the amount of family and visitors that come into as well. So
wow. So there's limits on who can actually visit kids who are in the hospital.
yes.
And y'all are gonna continue to probably monitor that and amp it up if necessary. What's it like then being a chaplain with kids who are in isolation like that?
You know, I think in every interaction we are creating the environment, you know, and as a chaplain and as a minister to the patients, the families, the staff, in every interaction, I'm trying to create a space for healing and for hope and for groundedness. And I try to take each moment with intention and try to show up for each person, not knowing how they're feeling in that moment and not knowing what kind of anxiety or fear they may have beneath the surface. Whether they're calm, cool, collected on the outside, they might be worried about their children at home with no daycare or, you know, things like that. And so I think more than anything, it is just mirroring the environment that I hope that we're creating for patients and families, and allowing them the space to share their fears and their worries and reassure them and validate their feelings and help them find some source of hope in the midst of all of the unknown and anxiety they may be feeling. So,
Right. I mean, not that I want to compare what's happening nationwide to what happens in a hospital setting, especially with children that are facing, you know, very serious illnesses where life and death is really in the balance. Obviously, it's not the same, but there are, I think, you know, as being I have a kid, and the thought, like DISD, our independent school district, just put out a statement that they're going to be closed indefinitely. They didn't even give us like a date on the back end. And Cash's daycare is like connected to their calendar, right? And so the thought of like being isolated with our kids, I think can produce a lot of anxiety. I don't know if you've seen like online, like everyone's like creating like daily calendars or daily list of tasks or trying to organize. As someone who works with kids who are, you know, kind of forced into situations that aren't you know, good situations to be in, is there anything on the spiritual side that we can learn from how you work with kids at Children's and what we can do at home? Like, is there any sort of spiritual direction or spiritual practices that we can offer our kids in the midst of this isolation?
yeah, I mean, when you're creating those schedules and whatnot, what you're trying to do is create some sense of normalcy, you know.
Right.
And I think the spiritual direction in the midst of all of this is, how do we remain soft in these moments that make us tense up, make us become hard, or make us lose our compassion? Or, you know, I think the lesson lies within, how do we think about others in the moment that we want to just think about us and ourselves and our family and isolate? And while there'll be physical distance, how do you intentionally show people that you value them, you respect them, that you love them? And to me, that is the spiritual direction that we need to learn and practice during this time is no longer can we just rely on outside sources for us to create the space to show those things. We have to intentionally engage in them in a way that makes us have the agency. And so with these children, you know, it is reassuring them that they are loved not only by their family but by God, and how do they look for examples of that within their life, you know. And for me, relationship is key, and intention and effort is key. And so how do we empower those families to find creative ways to let these kids know that they're not alone? And it can be a very lonely and isolating time, or you can reach out to those people that may not have their family, you know. They may not have those people that are checking in on them, especially in a church community. I would imagine there are folks who are in a very vulnerable demographic age-wise, and how do we continue to show and care for them while creating space? You know, I don't want to encourage that we go past what the CDC is recommending or what your local community is recommending, but what are the creative ways that we serve each other? Because to me, that is the most tangible way that we can see God's blessings in our life is through relationship and through tangible love.
Right.
So, yeah.
Stuff we can actually touch, right?
Yeah.
Meals we can actually eat. And like, I'm just shocked at how, you know, Cash was already scheduled, DIAC was already scheduled for spring break. And so like we were already planning on this week being kind of off kiltered and not, you know, well organized in terms of like structure. But what I realized is that even Cash yesterday said something, and he's 2, right? But and so he said something like, we're in the car, and he said, I miss my friends. And I was like, just like blown away by just the lack, just a small amount of time away from the routine of being with people that he can get to know and know that like his teachers love him. And like there's this broader supportive community that I think exists for our children that that we take for granted. And it's not just on an educational front, it's also all the like social kind of learning that happens there, and the feeling of safety that exists outside of the home for our kids. And I'm reminded, like in the midst of all this, that we have a responsibility really to like show Cash that the social connections that we have, while are very odd right now, we still have the ability to do those things. And I think like it's going to be really important for my own sanity and probably for his to like find opportunities to check in with his friends, to check in with people he knows from church, whether that's through FaceTime or video chats, or helping deliver some groceries to folks who need it, or whatever we find the needs are within a community. I think one of the things we can do is like involve our kids in that work too, so that they realize that like something is different, but we are still connected.
Sure. And connect with them. You know what I mean? Even if Cash is 2 years old, he's noticing things. He notices when dad is anxious or when mom is anxious. And so those children just kind of soak up their environment, you know? And so we are creating this environment of anxiety and fear, and we're not checking in with them and seeing how they are in those moments. We're doing them a disservice, you know, and just because he's 2 doesn't mean that he doesn't have some amazing insight. That's one of the things that I've taken away from 8 years of being a chaplain is it doesn't matter how old they are, kids will shoot you straight, and they will continually teach you something every day if you allow them the opportunity.
Yeah, that's a really good point. I mean, it's great that we have all these Instagram posts that are floating around, but like, what are we going to teach our kids, and how are we going to keep them learning in the midst of like being away from school? But the truth is, like, what are we going to allow our kids to teach us in this moment too? I think is really, really important and always overlooked. And I think it's easier to overlook that two-way street when we are so anxious and worried about what the next week's going to look like. Yeah, I really like that.
Yeah, I think too often we think that children won't understand something or won't be able to grasp something. And I think that's on us to be able to say, hey, you know what? Dad's a little anxious right now. There's a lot of things up in the air, but it doesn't change how much I love you. And just because I'm anxious, I appreciate that you care about me, because a lot of times kids will pick up on that, but they don't know how to articulate it, that, hey, I'm just worried about Dad, and
Right.
to be able to accept love from all sources, and from a 2-year-old especially, it's going to be unconditional. And sometimes we are so wrapped up in our own head that we forget to recognize the blessing which is right in front of us, which is this 2-year-old that's unconditionally showing up for us, or that even the pet, for those who are animal people, those dogs, those cats, those fish, whatever it is that you love, they show up for you in those moments when we may be too wrapped up in our own head to be able to recognize what's right in front of us.
I want to switch gears real quick. So as a healthcare professional, there's some practical things we can do to relieve some stress in our hospital systems, right? Like practice good social distancing and like make sure that we're not going just to the doctor for whatever, right? We're really intentional about when we go see the doctor and all that, so we can keep hospitals and doctors' offices as safe environments. Like, we know all that stuff, but what are some other ways do you think that folks like us who aren't directly tied to the hospital system can do to like support and encourage healthcare workers?
I think the first thing out of everyone's mouth should always be wash your hands. I cannot stress that enough. I know it sounds like a broken record, but please wash your hands. That is the number one thing that is going to pass this particular virus, or any virus for that matter. So that being said, I think one of the challenges with the healthcare system is that these people have taken this calling, this oath, this responsibility to care for others in times of need. And so a lot of times those people aren't asking for anything in return. And so acknowledging the intention that they show up with every single day goes a long way. I think saying thank you, I can't tell you how many nurses or doctors or RTs come off these 12-hour shifts and haven't been told thank you once. It's just been complained, or, have anxiety brushed upon them, and just acknowledging what they're doing on a daily basis and continuing to show up, and regardless of what they're putting themselves into in that situation. I think that's one. And then if there are ways that you can help out those folks, whether it's babysitting or, again, being mindful of social distancing, but, dropping off food or whatever it may be. And I think that extends everywhere. I think there's a tendency to gather resources, gather comfort, gather, as silly as it is with the toilet paper and everything like that, or baby wipes. What do you really need in this moment? And how can you think about others in this situation, not just your own nuclear family or yourself, And for me, I went to Costco in January because I bought a new home, and I have all this toilet paper. So I've been bringing in rolls of toilet paper and asking my coworkers, if there's anybody who needs it, like, I don't need all that.
How many rolls of toilet paper do you have, Paul?
I have a lot of toilet paper in my house. And so, like, I bring a couple every day, and then, I'm asking my employees who's running low, because I need all of that, and how do we think about each other in this moment rather than try to find our own sense of security. It's truly going to be a group effort. It's going to take a village. I know it's a cliche, but how do we think about others in this moment so that we can all become greater and a beloved community because of this?
Right. Yeah. That's a good point. Hey, what are you doing to keep yourself healthy and sane and happy, or finding happiness in the midst of all this?
Well, I'll be completely honest and vulnerable. I'm an extrovert, and so this is a very challenging time for me to
I
be.
know.
um, I am very keen about continuing to work out, and it sucks not to be able to go to my gym and to throw some heavy weights around after a really tough day. But I have to kind of get creative, and I think that's what these times are calling for. How are you getting creative, and how are you being intentional, and how are you continuing to show up for yourself and others in the midst of circumstances, right? And so, yeah, I'm eating healthy, I'm working out, I'm calling the people that I love, I'm texting the people that I love, I'm trying to reach out. In college, I played basketball, and our coach always said, when you're feeling down, try to go pick somebody else up. And so I feel myself doing that intentionally now, where I am intentionally going around and I'm trying to pick other people up. And it's those moments of true gratitude that really help me transform and integrate the isolation, the loneliness that I might feel into something greater and more connected.
Yeah. Well, and not having March Madness this year is a challenge.
Yeah, I mean, no sports is interesting. Yeah.
The good news is that as a Golden State fan, your season was already lost like in week 1, so you're not really even having to worry too much about the NBA canceling.
Oh yeah, I mean, high draft pick is great. If we ended the season now, we got the worst record, so I'll take that number 1 pick. That'd be great.
Brother, hey, we need to get a call with all our seminary dudes and keep staying connected. I think like that's one of the things that I'm finding is helpful is when I get to sit down virtually with my friends, and I think that's something that we really can all do, and we all should do. But if we don't schedule it, it's not going to happen, right? So like, one of the things that I want to remind folks who are watching is like literally one of the healthy things we can do for ourselves and for others is find a way to like put it on the calendar and be like, all right, at 8:00 tonight, I'm going to like video chat with folks that I normally don't do that with, like it's one thing to stay connected to our families. And I think, especially with my parents having a grandkid now, we're always constantly on FaceTime with them, but it's those other folks that we've never done it with, or, we've never really thought about, hey, like video chatting with. I think it'd be really healthy and important. And we're trying to push a lot of our stuff at White Rock online. And so, we had a book study online on Sunday, and it was kind of awkward at first, but then it, like we got into it, and all of a sudden it was really good for the soul. So I think there are some ways we can like be intentional, not only about the space we create for our kids in this time, and I think everyone's going to try to do that, but also be intentional about the space we create for ourselves and the way that human interaction is certainly changed for this interim time, but we can still get some relief from seeing one another and joking with one another and making sure that we stay connected.
For sure. Mitchell, man, I want to say I'm just so proud of the work that you're doing with your church, and those folks are lucky to have you, and I love you a lot, man. It's really good to see your face, and let's do this sooner rather than later. How about that?
All right, man. Go give an elbow bump to like a doctor or something for me. I'll catch up with you soon, dude.
All right. See you.
I appreciate you.